I graduated from the Medical School of University of Newcastle upon Tyne, United Kingdom, and thereafter I came back to work and subsequently went overseas to Sydney, Australia for my further postgraduate training. I trained in Sydney Cancer Centre, which is part of the Royal Prince Alfred Hospital and part of the University of Sydney. There was also a very strong breast cancer multidisciplinary team at that time, and hence also my interest in breast cancers. I subsequently returned to Singapore because of after my postgraduate training in Sydney, because of my interest in basic translational science research. And I worked at the Genome Institute of Singapore doing basic lab research, and was also had an employment as associate consultant at the Department of Medical Oncology at National University Hospital. It was a very good experience for me, but I was also then offered to return to Sydney as a consultant working in a public teaching hospital. A couple of years later, I was appointed the director of a clinical trials unit, an experience which was very fulfilling because of my interest in clinical research. I was then also appointed as director of the head of department. Was also very active in teaching clinical students as a clinical lecturer of the university. In between times, I also serve as a visiting scientist to the Garvan Research Institute in collaboration with some scientists with lung cancer as well as colon cancer projects. And part of this has also led to my current pursuit of a master's in trying to optimize treatment for colorectal cancer. My interest in medical oncology is multifold. Many years ago when I first started, oncology was a relatively new specialty. There was a lot to learn yet of cancer behavior and to improve cancer treatments. So there was a big scope for further improving cancer treatment, and I felt that there was a lot more that one can do as a clinician. The other reason is also part of the current challenges that one faces as oncologists. Which is, I found that at that time while in my early days working in oncology department, that treating cancer patient was a very holistic process. Oncologists take a very thorough, holistic approach when they treat a cancer patient, not just the cancer as a disease, but the patient and the family. And it's more of a journey that you need to support the patient through an emotional journey, as well as the clinical side of things. And that, I feel, is what a doctor should practice.